So thank you for joining us today. We have with us Mr. Ardi Hardjoe from Thye Kwan, and he's going to be sharing with us more on care leadership. Thanks for joining us, Ardi.
Hi, Janice. Thank you for having me today.
Fantastic. So do you think you can share a bit more about your organization and what you do to care for seniors?
Yes, Thye Kwan is basically a multi-service organization, especially in the role for seniors. We're really at the start and at the end of the ILTC or intermediate and long-term care sector in Singapore. So we run a hospital, which is focused mainly on rehab and taking in subacute cases. So those with very good rates of recovery or potential, they are taken in and we do progress along with them in their recovery journey. But on the other end of the scale as well, we do take in cases who sadly are waiting their time. And those are the nursing home cases. And we focus on taking on cases which are in Singapore. And we use the resident assessment form. So they are Cat 3 or Cat 4, people who really need help in terms of mobility and people who are literally flat on their back. But yes, Thye Kwan is a multi-service organization. So we do have specializations, not just in elder care, especially in the ILTC sector, but we also specialize in delivering services to people who need it in the areas of family services, things like counseling, as well as disability. And that's for everybody from children all the way to aging adults. So that's what we do as an organization. But my role literally is to focus on the running of the services at the hospital as well as the nursing home.
How many seniors do you look after, and how big is your workforce to look for so many areas that you are taking care of?
Okay, at the hospital, we have roughly about 500 employees, and at the nursing home, roughly about 200. So we are doing more than just, the two polar extremes of the LTC sector. So apart from running the hospital, we also have services for the community. We also have center-based services. And then, of course, the facilities to take care of those really coming from the hospital and those who are waiting for their time.
Great. And what does care leadership mean to you?
Okay, I think care leadership is definitely important. I think it's we hear it often enough. It starts from the top. It comes from the heart. If you look at our logo, Sin, the Chinese word, it literally means heart. So I think yes, it's important to start there. For us, I think when we do recruitment, we don't just hire people based on skills. But I think it's very important to go into the heart of it, which is what's their motivation? Are they inclined to giving more in terms of the people that they serve? Are they happy to serve the people that they're tending to? Otherwise, it becomes a real job. It's not a vocation.
Yeah. So what tips do you have for some of the fellow care leaders out there who are looking to hire those with a heart? How do you find these people?
Okay, I think I think right now it's really tough, Janice. I have to admit that even I'm struggling, and being in top management, we try to set the tone. We try to build the culture that we want, and that's actually necessary for the people that we serve. But ultimately, I also rely on a team, who have expertise in the various clinical areas, but they too need to have the heart to pull the right people in. At this point in time, I think there's a huge crunch in this labor market for skilled people to run the services, especially in elder care. You've seen nurses leaving Singapore, and the reason for that is it's obvious. because a lot of them have families they want to be with, and countries like Australia, Canada, the UK, and even America, I think they do offer better options. So it's a whole host of things. But looking for the people with heart is something that is important. So we hire based on values. It's easier said than done. Ultimately, Singapore is throwing a lot of money at this human resource problem, and we have to keep along with that line of thinking as well. But of course, we try to do more for our people. We try to make it a happy environment for them to work in. And if we have good nursing leaders, good clinical leaders, then I think we should be able to attract the right type of people into employment with us.
And that brings us to the question: what is your care philosophy?
Okay, I mean, I think care philosophy is very tricky, because at the end of the day, we have care, which is rather clinical, and there are certain standards that we need to meet. There's different levels of quality of service. We have to be very mindful of patient safety, and things like that. And then when you have the philosophy, and for us as a hospital especially, we are trying to nurse people back to good health. So sometimes there's a bit of a contradiction between the two, because we do serve, or rather we report to the Ministry of Health, and they set certain standards and guidelines, and we are also a licensed institution. So they do look out for indicators like falls and things like that. And sometimes everybody has targets, and in meeting those targets, it's hard. And when we are rendering service and service from the heart, sometimes it's difficult, because, for example, if you take somebody who's processing a client or patient, and that person takes 30 minutes, half an hour, and that's 10 minutes more than the next more efficient worker. So how do we measure things like that, right? So it's a tricky one, but the long and short of it, we are still very PCC or patient centered, and we're very focused on delivering that sort of service. So of course we are looking at doing more, but the medical measures really, and the requirements that we need to keep track of, all these figures and things, simple things, even like tracking falls, tracking the treatment of wounds and things like that. They have to be done. But ultimately, we are patient focused, and we do want to take a more holistic point of view on things. And also being, I think, an economics graduate, I believe that we need to have lenses, both micro and macro, so that we can zoom in, zoom out at the problems, and look at things more systematically, with a systems lens as well, so that whether you apply design thinking or other notions like that, it's important to see how one change or one thing interacts with other parties, other actors, and it affects the whole. So yeah, that's the view that we want to take. And I think just to add on, just the last thing, and I think it's important, I think the well-being of the patient is super important. And ultimately, we're also looking at alternative things that we can do for them. So alternative medicine, I think it's more work could be done for that. I mean, we would like our patients to fill their days here, because otherwise they get very bored. And of course, we look at quality of life issues and things like that as well. Yes.
Well, you must come across many experiences with seniors that has touched your lives. Can you share with us a story of how a senior's life has improved since being under the care of Thye Kwan, and after the exposure to the various activities or services? how has that senior's life improved? And this is probably one of the many stories that has touched your heart.
Yes, I think there's too many stories. Thank you, and I'm really confused now because there's just tons of things I want to share. But let me just share this particular one of a stroke patient. So this gentleman, he came in with a stroke, and we tried to do our best to let him recover. So after about a month and a half with us, he was finally good enough to be discharged back home. So he managed to get about 70% of his ADLs, activities for daily living, on par. And he was sent home. I think the family really appreciated it because he was really suffering, when he had his condition. He was really suffering from depression. He was feeling very down. He was in despair, total despair. Of course, as time progressed, as he received treatment here, and he went on a rehab program, he recovered some use of his arm and his leg. He was never 100% again. And of course, his speech was also affected. But the family was very grateful for what was done for him. And they shared a funny story. So it's a story within a story. And they said, hey, Ardi, thanks for bringing him back. The moment that he could start complaining and started scolding us, we knew that he was more or less okay. And they were really thankful that they had that extra time with him. Unfortunately, since then, he's passed away. So after his recovery, he had about 18 months with the family. And ultimately, this family was so appreciative that, we were doing this kind of work. And it was meaningful for them that they made a $1 million, Singapore $1 million donation to the organization, which goes a long way because we are a charitable organization. I think it's an incredible and powerful and touching story. This narrative of having extra time and having the ability to say goodbye to their father was important to them.
And I think, it's not just about the extra time, it's about extra time with a reasonable quality of life and being able to continue to communicate with his family in the ways that they are used to, even down to being scolded by by that gentleman. I think he appreciated it. That's how much it has helped them, all of them, I'm sure, in also remembering that the person he is, and the time that they have with him. I think that's very important.
That's right. That's right. Even though physically he was still struggling, but they knew that mentally he was back, and he was back to give them a hard time, which was what they needed.
I think that's truly memorable. Well, let's look at the topic of technology. And as a non-tech person, we know you love looking at the different technologies out there. What are some of the tech implementations that your organization has utilized that has helped to provide better care?
Okay, I mean, there's been many. I think in terms of technology, my point of view really is that of appropriate technology. We do not need any more tech that's going to add more requirements for extra manpower and wasting more time on administrative tasks. I think that is something that we really want to get away from. We have a fair bit of tech. A lot of it is really focused in increasing productivity. So especially in the workplace. So anything that reduces man hours and makes life easier for my staff. We've had tons, but I think today I would like to focus on our investment in one area. So the one that we had recently was basically to help with assessing the risk of fall in terms of walking. So I think this tech is really good because it really helps to get the assessments done with data, which does not require any human intervention or any sort of analysis by a human being. Usually it's done by usually it's done by a therapist who's trained, and a lot of it has to do with their own analytical ability. But here, I think in terms of using certain devices which help to track the movement and gait of the patient, we are able to come up with very objective data. And also in terms of the AI that comes with the technology, the standard stand up and go test, I think it helps a lot because it also recommends exercises to help the patient cope with that, to build up core strength so that he doesn't fall. So I think frailty in elder care is a huge thing. And I think this is something that needs to be part of the process or part of the standard things that we do for that. Is something that needs to be addressed. And I think that particular technology has been very helpful.
And I think that brings us to the next question. How do you help improve quality of life for your clients who are living perhaps in your nursing homes?
Okay, I think for the nursing homes, they really suffer from four things. Anybody who is institutionalized, I think, would suffer from loneliness, boredom, despair, and those kinds of issues. A large part of it has to do with the very fact that they're there and they may not be doing anything which is meaningful. I mean, if you're really sick, you would be in bed and you would be sleeping it off. But if you have an active mind, you're awake pretty much most of the time, then you need to be engaged.
Yes.
So we do our best really to have bedside activities for those who can't join in group activities, and to engage the senior in whatever way they can. So whether it's an art program, whether it's pet therapy, or even playing musical instruments, and things like that. Even befriending is a very very unique thing. You know, I think it brings smiles to people, so that they're able to also do reminiscence therapy at the same time. In fact, we have been in collaboration with corporate partners, with schools and things like that. A most recent one was with Bank National Lipari in Singapore, and they've done basically befriending with our patients and clients. And I think it's been really useful because they say, wow, this senior really, they really look forward to being visited and being engaged. And that's really what living is all about. Especially in the nursing home, they might be on their last legs, but quality of life is important. And that sharing, that ability to have friends, to connect, I think is key for them.
And where do you see the link and balance between quality of life and quality of care?
Okay. This is really a tricky one. Simply because, again, I mean, it comes back to us being coming from a clinical background. I think in Singapore at least, elder care is really under the Ministry of Health. Usually we have doctors running the place, and formulating policy. So they're very focused on disease. Of course, we are moving away from that now. We are looking at other things. They are a lot more enlightened now, that there's also therapy. There's simple things that could be done. The ideas of social prescribing, the ideas of alternative therapies, and even counseling and befriending is something which is they're welcoming it. They're coming in with an open mind. So ultimately, I think quality of life right now it's still very much measured in terms of ADLs, activities for daily living. But of course, there's also a renewed focus in terms of mental health, mental well-being. So I think, yeah, we're going to create better programs. And like I say, it's how do we fill up the days of our patients, especially in facilities, whether they're in the nursing home or in the hospital recovering. I mean, if they're alive and awake, they want to be engaged. They want to spend meaningful time.
And I think also that comes to the implementation of possible technologies to help to monitor and track some of this progress that we are making on quality of life and quality of care. Currently, are they being used, and how important do you think it is?
That's right. I mean, you raise a super important point. I mean, we have quite a lot of tech, like I said earlier. So one of them is actually the telepresence robots. We have quite a few robots, but telepresence is one of them. It not just helps the patients, it helps the staff as well in terms of doing their rounds. But it's quite surprising that, the old folks, some of them, it's their first touch with robots. So they're really surprised. And they speak to it like as though it's a small child sometimes. But we've also used the robots also for other things. Even I think over the COVID period, even the robots were used for Zoom calls and things like that, apart from just the iPads and telephones and things like that. So yeah, it's been really good. And I think in regards to therapy as well, to make it a lot more interactive. And this is not new. It's been around for 20 over years. But the use of kinetic technology for therapy, yeah, that's I think you find it in a lot of the elder care facilities, or any other place for rehab as well. So that helps them to track their goals, to make it a little bit more challenging, and to keep them engaged. So the use of games and things like that, it helps as well. So yeah.
Great. Well, that brings us to our last question. Given the global labor shortage and the tough competition, how do you motivate and develop talent in this sector?
Okay. Wow, that is really the golden question, Janice. You put me in a tough spot. Okay. I mean, for us, we really try to do our best. I think in little Singapore, the government is really on top of everything. So they have been very good in terms of providing not just funding, but also platforms for us to show appreciation. So there are a lot of awards that we could apply for. And if they meet those standards, usually my nurses get recognition for it. It's not just nurses too. It's any healthcare worker. But right now, of course, the focus is on nursing. Yeah, for us, I mean, we try to do a holistic thing. And for me, on a personal level, I do speak to my staff, and I do have a hand as well in trying to make sure that the voice of every staff is heard. So apart from doing things like town halls, little get-togethers, eating food or makan sessions in Singapore, we call it. We, during performance evaluation, apart from going through the KPIs, we also talk about training, the competency needs, and also value-added training. But beyond that, I also get them to engage our staff in sharing their career goals and plans. We don't always talk about career progression, but we talk about career development. We talk about personnel development. So that's what we try to do. We still strongly encourage everybody to go for the training that they need. But right now, I think, especially for the issue for us, I think for the local staff, it's the weekends are very important. So we do have some initiatives that help to deal with that problem. For our foreigners, I think that family is very, very important. When they reach a certain age, they feel that, okay, I've worked 10 years in Singapore and I want to reconnect my family. So we do little things and big things. We do our best. So in this situation, in addressing that problem, we even help to sponsor the staff for PR in Singapore and things like that. If they in whatever shape, big or small, we are always here to listen to their needs. But of course, they also need to speak up. So we do our best.
Well, thank you very much for sharing. And I think it's all the little things that add up to help us with, trying to really maintain the love and passion that everyone has and to grow the workforce for the care sector. Well, today, thank you very much, Ardi, for sharing from your heart about the opportunities, the challenges, and the bright future that we have for the care sector. Thank you.
Thank you, Janice.
CarePage Business is the only feedback platform designed for the health and aging sectors. With CarePage Business, you can uncover powerful customer experience insights, monitor resident or client feedback and complaints in a single, easy-to-use platform, and get the insights you need to drive continuous improvement in services and facilities.